This is Char. I have a question I want to ask you. Have you ever seen people sick, always sick, or never get well? It takes them a normal person a week, but they take about weeks to get well. I'm going to talk to you about how the immune system works on these people. You know, when I was a kid, I was cleaning up my father's office, and he was a dentist, and he used to use the mercury and the powder and mix it together in a mortar and pestle. And what he did, basically, he squeezed with a squeeze cloth. All the mercury fell on the table, on the floor, and I thought it was fun. I played with all the beads. And later on, I found out that it was toxic. And then I went to dental school and became a dentist, and I was putting mercury fillings in, and I started to say, oh, am I polluting the patient? I'm making them sick with toxic metals? And because it was 55% of the silver filling. And so I started to get guilty about it, and then I said, I better learn more about it. I went to Germany to study under Dr. Bo and Dr. Joachim Thompson, a dentist, and then I traveled to South America to study with Herman Duque, and I found that there was more to toxifying the patient and breaking down the immune system and getting sick. I started to go study more, and then I started to learn homeopathy, so I got my doctorate in homeopathy. And I said, oh, I better learn more about the science. So I went to a doctorate in natural medicine. And I said, I better learn about the body. And so I went to massage school and became a certified massage therapist. Besides being a dentist, I was the first Hawaiian dentist, holistic dentist in Hawaii. I'm going to share with you from this story, what I did to help with patients who have immune system deficiency. Journey with me through the epic saga of a massacred immune system. I want you to visualize your body as a castle, an external portion of the body that's been invaded by attacking invaders, the army, and to get through the inside of the castle, which are inhibitors and the king. And the castle wall is the skin and the mucous membrane. And you will actually see that the army is really attacking in our video coming up. So visualize that. And once they break through the wall, you're going to plunder, you're going to go ahead and torture the people, and you're going to go ahead and rape the woman. That is the internal body, is the organs, tissue, cells, and muscles. And here's where you have the metabolic syndrome issue in the base of the immune wall, and where all the disease congregate from the external forces, and they're digging underground tunnels underneath the wall, just like how the Great Wall of China was invaded, how they got through the Great Wall of China. The external can be chemical, you get chemical pollution, you get radiation, you get all these different toxic foods and sprays that we use every day, the ointments that we put on ourselves. That is a camouflage, which is the metabolic syndrome. And then what happens is they break through that, through the skin, and get into the internal wall where they rape, plunder, and torture the inhabitants.
The peasants were confident of victory. They believed God was on their side. They faced knights with cannon.
When you look at that, you can see that there's all kind of factors that contributes to the metabolic syndromes. The high blood pressure, through the skin and mucous membrane, which are the exterior defenses of the body. And once they get into that, then we're talking about another thing called disorders or autoimmune disorders. Chronic ones that are chronic inflammation, and there are tunnels that goes deep into the body. They look for openings as the mouth, the eyes, the ears, the nose. Anemia, stress, insulin resistance, gout, fatigue, heart palpitation, dementia, skin tags, abnormal clotting, lack of exercise. They are at the base of the wall where the metabolic syndrome houses. Those are chronic diseases surrounded by many toxic elements. The thing that most people now are getting more attention to is the VOC, volatile organic compounds. And they can include perfumes, hair products, paint, cleaning sprays, gasoline fumes, deodorants, soaps, and they pollute the air. And it's absorbed within the skin. And when many of these factors, external factors called stressors, accumulate, they can cause the symptoms which can be a high risk factor for osteoporosis, cardiovascular problems, liver cirrhosis, psoriasis, renal problems, stroke, diabetes, and cancer. The body has an immune system defense. Every organ or muscle and tissues, each of them have cells that defend the body from invasion of toxins. They have their own defensive mechanism. And when the invaders overcome the natural defenses of the body, of the particular organ, tissues, what happens is they form some kind of disease or disorder. Then you can have an autoimmune disorder. We're going to talk about the internal inhabitants of the castle that's within your body and how the system works with immune deficiencies and natural body defenses within the body, how it can ward off some of and defend some of the aggressors. And then we're going to talk about how within the wall there's the king and inhabitants. And those inhabitants on a daily basis living, and they try to protect themselves with having a wall or with soldiers around the wall. And that's the natural defense of the body.
And plundering monasteries and castles. It was a revolution. Götz the knight joined the peasants. They could use an experienced commander. Under threat of death, he agreed to become their captain.
Ich will nicht, aber ich muss.
You see the stressors which are external outside the castle wall, which is the defense of the immune system. You see blood disorders, airborne microorganism, environmental chemical pollutions, radiation, electric pollution, acute inflammation, parasites. And once they border into the wall, which is the immune system wall, they will develop into a chronic inflammation, delayed growth and development, digestive problems, which is the first sign of metabolic syndrome in advanced stage. A bearer of the defensive mechanism of the body has non-specific defenses as well as specific defenses, which break down to antibiotic response to B cells, lymphocytes, WBC, white blood cells, inflammation responses, antigens, memory cells, plasma cells, proteins, histamines, helper T cells, B lymphocytes, phagocytosis, and vaccinations. Specific defenses or specific defenses all are part of the cells of the organs, muscles, and tissues. We're going to have a discussion on holistic approach, and I'm going to show you different things about how we assess so we can get to the cause instead of the symptoms. Yeah, we need some symptoms, but it all joins into finding out the cause. We look at the immune system, look at the dental medical history and what didn't work for you, type of treatments, drugs taken, or physical exam. We also consider other factors to strengthen the defense barriers. We're trying to neutralize these caustic cells of microorganisms, environmental pollutions, chemicals, emotional stress, physical trauma, and spiritual disbelief that you might build up on. And we could talk about organ immune system, organs. We talk about that. And we're going to talk about many other researches and development that came up recently that says we can reverse some of the things, but you got to get it to a point before they get into a degenerative disease. That's called prevention. And I'm going to show you the whole process, how the body processes all this before you can get into a disease state. The skin, the mucous membranes in the bladder and genitals, the mucous membrane in the nose and throat. Those are the exterior immune system wall. And then you look at the bowel, which is the digestive system, which is connected to the neurotransmitter serotonin related to the brain. On the spleen, which produces the red blood cells. And the bone marrow produces the immune cells. As you get older, you get less of them. The thymus, which is an endocrine gland related to the immune system defense. The lymph nodes, which are related to the lymphatic drainage system. When a person tells me about his health problems, I relate it to a specific chakra, which are 13 chakras here, because they give me a relationship to affirmation of foods, the personality traits, the color, the planets, the nerve plexus, the numerical number, the sound, homeopathic remedies, quality of life, frequencies, shapes, emotions, gemstones and minerals, essential oils, organs and glands, acupuncture points, meridians, and yoga. You can also evaluate the chakras and the functions of these chakras. You can use this as indicators to compare it with other testings you may find. Chakras is also related to the Chinese 5-element law, the wood, fire, metal, water, and earth. Enough! I'm sick of being sick. My immune system is devastated. I love looking to the mirror as to what I see and how healthy I look. Holistic approach. And I'm going to show you different things about how we assess so we can get to the cause instead of the symptoms. Yeah, we need some symptoms, but it all joins into finding out the cause. Look at his emblem. The top is spiritual, and the next energy level is bioenergetic. Then we deal with the emotions and physical level. Man is an electromagnetic being. You need energy in the cells to be healthy. Without it, the cells in the tissues, muscles, starts to lose its vitality and elasticity and die. When you have more dead cells than healthy cells, the body gets sick and eventually turns into a degenerative process and eventually a disease. You don't want that. If you don't have an energetic, healthy cell, your physical body will start to get pain, chronic fatigue, muscles become rigid, and you will age rapidly and get sick. I learned how to be a holistic practitioner by learning the principles of homeopathy by Dr. Samuel Hahnemann. Then study further Chinese medicine with acupuncture and meridians, and Ayurvedic medicine, along with traditional medicine. Brain wellness therapy, how the body can use the brain to remove some of the kind of symptoms that you have. This is called retracing. The brain stores every traumatic incident you suffer in life, whether it's verbal, emotional, and physical. Every experience you had in life, whether it's traumatic or good, is stored in the brain. And it becomes layers and layers, especially when you had pain, suffered pain or injury. And then you must remove those layers slowly. And we use the CET, Comprehensive Hemogenesis Technique. We look at the immune system, and we're going to show you some things about how you can take care of it on a biological sense with herbs and Chinese medicine, Ayurvedic medicine, homeopathy. Inside the castle wall, you will see some biological herbs and remedies. Those are used to build up the immune system or wherever the immune deficiency is. You can test for these remedies that you need with a biofeedback scan, or kinesiology, or CRI, or any type of Bose meter that you may use. Many other researches and development that came up recently that says we can reverse some of the things, but you got to get it to a point before they get into a degenerative disease. That's called prevention. And I'm going to show the whole process, how the body processes all this before you can get into a disease state. We can reverse some of the things, but you got to get it to a point before they get into a degenerative disease. That's called prevention. And I'm going to show the whole process, how the body processes all this before you can get into a disease state. And so we use many transitional types, and that transitional can be modern medicine with technology. And we can show you sound therapy, biofeedback, and all that. But you see, that's the process that we're going to show you. And then we're going to show you a progression of how you get into degenerative disease. When you are tested naturally through kinesiology or biofeedback scan, CRI, or the Bose meter, you can also see if the doctor diagnoses that symptom for you. Let's see if the doctors can refer you over to additional testings, and then see if what stage you're in. Are you in the early stage before disease or in the disease state? If you find out that you're in the early stage or moderate stage before disease, then do you have the option of using natural remedies for a prevention stage, or do you have to take the drugs? That's your option. And I'm going to show the whole process, how the body processes all this before you can get into a disease state. The main thing right here is how you get to a non-metabolic syndrome, and which has high risk factors. And that transition can be modern medicine with technology. And we can show you sound therapy, biofeedback, and all that. But you see, that's the process that we're going to show you, how you get into the disease. No metabolic syndrome. Because remember now, I told you those metabolic syndromes is like in front of the immune wall. It goes in tunnels and becomes chronic infection, chronic inflammation. And you don't want to get into that, because once they penetrate the inhabitants within the body defenses got to be strong enough to repel them. If it's not, then it's when you get the first stage of autoimmune disorders, and then you get also a degenerative process. For is a healthy, anti-aging body. Within the castle walls is your internal defense, and that should be strong enough to repel any heavy, toxic, elements that invade your body cells. You want to reduce the risk factors, which is the metabolic syndrome, be strengthened in the system wall, and then reduce any stressors or symptoms that might invade your body. You need immunity boosters, and that's a spiritual, which is faith in God, tranquility, which is controlling emotional stress, nutritional dieting, the right types of food, and taking good supplements, energy exercises, non-resistance exercises, especially for elders over 65, immune wall being impregnable and reducing and having no stressors. The overview of the immune system. We're going to show you a picture of it has green, which is defending against the armies internally. And then you also talk about the red areas that you read, and that's the stressors, the external forces that come in with the body. Take care of it, how you can break it down before it goes further to degenerative stage. You also will go into dysfunctional stage where it's a physical level. So you get disorder, and we talk about how these symptoms can go into a fever, acute inflammation, or free radicals or cytokines. We're going to show you all that in a process where if you don't take care of it...
As in ancient Jericho, the walls fall before the righteous.
You want to avoid these symptoms because first of all, you're going to get a fever or chronic fatigue, general malaise, which can affect your joints, muscles, skin, red blood cells, blood vessels, connective tissue, and endocrine glands. The autoimmune disorders. Remember, it's disorders. It's not a symptom. It's not a degeneration where the more old cells take over the new growing cells. We're talking about no degeneration. So it's in a flux stage. So how do you get that? Because once they pass the immune system wall, then people don't know what it is, what kind of troops are there, what kind of people are invading, and that becomes an autoimmune disorder. And then what happens is it goes further to degenerative stage. You also will go into dysfunctional stage where it's a physical level. So you get disorder and dysfunction. Known causes for immune system. Okay, take care of it, how you can break it down before it goes further to degenerative stage. Don't go any further to get into a degenerative state where the deteriorating cells are invading, and then what they're doing is overpowering the good cells that are building up your body up, vital cells, give energy to your new cells, give energy to your body. And what happens is that degenerative overcomes the body and becomes into a form of degeneration because the body can no longer defend itself internally. And that's what we call disease. A disease state is called dis-ease. So we're trying to prevent that. That's what holistic is all about. You see my video, this whole video on YouTube. But you know, I had to go pretty fast because I had to summarize everything. Because they're telling you every detail of each one with techniques, the amount of videos and hours, which will be hard on you to watch. And I said, instead, you can pause it. You can pause the area, get an idea what it is, and then you can use some things like kinesiology, biofeedback, and everything to select the choices. And then when you get the choices, then you find out the dose and the amount of time you're going to take it, how long you're going to take it. And that's the idea, where everybody can see it all over the world. And that's every week we put on one comment. And this is the major one, which is an introduction to what we're going to be giving on all the different facets of the immune system. And then we're going to also go into different phases of exercise, diet, nutrition. We're going to talk about emotional. We talk about the energy of the cells and how you can do electromagnetic and how you can defend yourself from all the energetic part. And we're going to talk about the energetic part and the physical part. It's called electromagnetic. And we're going to discuss that. And we're going to put on playlists. So you stay on my playlist, you're going to see all those appear over a period of time. You're going to see that every Wednesday we're going to continue giving you more education and tips. Not only education, but tips on how to treat that. Okay, we're not treating it with drugs or anything, because you can go ahead and work with your physician. We don't say, no, you shouldn't see that. But we can say that there's an alternative. If things don't work on the drug side, the chemical side, you're going to look at different options. Go organic and try that. You know, be natural. But that takes discipline. And then we're going to show you that all the facets, and it's going to be a long series, but it's going to give you a lot of information, and some of the information will be things from my practice. I've seen research. I've been all over the world taken from the masters, and I'm going to give you all that information in a condensed form of playlist. So look me up. Your Health Video every Friday, 3 p.m. Eastern Standard Time. I'm asking you for comments to give me, and any kind of criticism, or if you like it or don't like it, put it in your comments. And then you can Twitter me, or you can put it into a YouTube comments, or you can even put it into Facebook. You know, I encourage that because you get better with the comments.